In our study was a mean of just 39 years old for the patient, so we can use sometime the age to better assess the premenopausal, postmenopausal status, but it's also easy because we saw that nowadays we can have patients also 50 years old that are still in premenopausal status. So this could be something that can help us to test maybe more frequently the patient, but the only way to be sure that the patient is in premenopausal or postmenopausal status is the lab test of the estradiol, the FSH level at least. Maybe also the anti-Mullerian hormone and the progesterone, the LH, could help us to better assess the status, but at least the estradiol and FSH level are mandatory to discriminate this new population. In our study, we had 343 patients enrolled only in our center. So even if the two studies we performed the exploratory analysis are multi-center, for this type of exploratory analysis, we use only the patient enrolled in the main center. We didn't saw any association with other type of clinical characteristics. So also we could expect that maybe lower age, a higher BMI that is described in the literature that could reduce the efficacy of GnRH analog on the suppression could be related in our study, not only for the baseline characteristic, but also in the univariate and multivariate analysis. The only factor that remain associated with this higher risk of suboptimal suppression is the administration for the aromatase inhibitor.